So this is block 3, and question number 1 is what skills described in chapter 7 identified on the leadership skill questionnaire would you use to secure needed resources? On the questionnaire, I scored high on all 3, administrative, interpersonal, and conceptual skills. So in chapter 7, what I would use to secure needed resources would be planning, organizing, providing appropriate and adequate staff to provide safe care for the patients, directing, which would be good communicating well with the staff, giving clear direction, and being a good listener, coordinating by assembling personnel so they function harmoniously to obtain organizational objectives, and controlling, which is to ensure tasks to be accomplished are appropriately executed. Question number 2 is how would you use published literature in the process? So the literature I chose was Resistance to Change in the Nursing Profession, Creative Transdisciplinary Solutions, written by Carrie S. Clark. And in this literature, she noted that the profession of nursing had historically struggled to realize caring was the essence of the nursing profession. And the profession was put more emphasis on technical, medical, and cure-based modalities, and did not emphasize humanism, healing, spirituality, and lived experiences of interconnected beings. So with this, we had a failure, nurses had a failure to move towards the humanistic values of caring and loving, is evidenced in high rate of nurse graduate leaving the profession and ongoing nurse dissatisfaction and in nurse burnout rates. So she came up with a transdisciplinary approach to inquiry, and she felt that that would help empower and emancipate the profession of nursing on several levels. So she did this literature research while she was doing her doctorate. She was a instructor at a university for the nursing program, and she noted that there was resistance to change. There was not a lot of resources for mentoring and lack of training and mentoring for the new nurses. So resistance to change in nursing, like resistance to change in personal life, is based on fear and uncertainty, doubt and frustration. So in the article, it demonstrated how the transdisciplinary inquiry approach can benefit the nursing profession in our process of shifting the paradigm towards caring and loving, care, love, and healing of the patients. So as a manager, I would promote this in the unit by taking the staff that I have, because we all have different backgrounds, different lived experience, different ethics. They can all be blended to create a change and benefit outcomes for the patients. So question number 3 is identify the levels and departments you would need to work with in order to be effective in your role. So as a manager of the emergency department, we would use a lot of different departments. We would first work with the hospitalist to admit our patients that the doctors needed to admit to certain floors. We would work closely with the directors on ICU, telemetry, and the medical units to ensure timely admission of those patients. We would also work with the surgical department for surgical transfers. Closely, we work with radiology, the laboratory for labs. We work closely with the clinical administrators of the hospital to get bed placements for the patients. Work closely with EVS with cleaning, distribution for supplies that we need for the unit, maintenance for repair, and things on the with our equipment. So question number 4 is explain if you feel you would have a preference for vertical or horizontal structure in a particular model. So I feel that horizontal is the better structure because it's an employee-centered approach with emphasis on teamwork and collaboration. And the particular model that I chose in Chapter 7 was job design, which is support for nursing, autonomy. This type of design includes nursing in policymaking and strategic planning and monitoring of quality patient care.